This medical moment is brought to you by Mercy Health. The care you need, when and where you need it.
Welcome back to First Edition on this Monday morning. Today we are talking about what they do at the Neuroscience Institute at Mercy Health St. Rita's. Joining me is Dr. Salma. You're a neurosurgeon there. Welcome back today. And you were telling me about this NPH, normal pressure hydrocephalus. It's something you guys deal with at the Neuroscience Institute. What is that if we've never heard of it?
Thank you very much, Alex, for having me today. So basically, normal pressure hydrocephalus, it is a disease of old people. And this disease, basically, there is accumulation of a fluid inside the skull. And this accumulation of fluid inside the skull, it is as under low pressure or like normal pressure. And this is just opposite to what we usually see when there is accumulation of fluid in the brain or inside the skull, and which usually causes increase in the pressure inside the brain.
And are there symptoms of this? I guess how would someone know if they might have this?
Yeah, so it is very good questions. Actually, symptoms-wise, this condition classically described as a triad of the progressive dementia, like gait and balance impairment associated with the losing the ability to control the urine. Yes. Now, what is the important, or what is the significance of this disease, and why we should we recognize and diagnose this disease? It is a kind of reversible dementia, or dementia that we can treat. Actually, it is up to 10% of dementia cases are due to this condition, normal pressure hydrocephalus.
And that's probably surprising to people because dementia is becoming such a problem. This is actually a way to treat some of this dementia, but what exactly is the procedure if someone were to get this
Usually
done?
the treatment of choice for this disease to place what we call ventriculoperitoneal shunt, or VB shunt, and this is basically a tube from the brain cavity under the skin all the way down to the abdomen cavity. And so this is the challenging in treating this condition to know which patient is gonna respond to this treatment, and which patient or which patients don't. Yes, and this is why we in our institute we follow or we do what we call or we developed a protocol to treat this condition, and our treatment strategy for this condition, actually we do what we call now normal pressure hydrocephalus protocol, and this is based on multidisciplinary approach. So our neurosurgery team with our physical therapy team work together so basically we admit the patient, and we did a trial for him, and so before placing a permanent shunt, this permanent tube, we admit the patient to as inpatient to our ward in the hospital, and we do like a baseline assessment for their gait by our physical therapy team, and for their cognitive function, and then after that we place this lumbar drain. So, and we do this draining according to specific protocol for 3 days, and every day we do another assessment, for their balance, for their gait, for their cognitive function, and after 3 days, if we see there is improvement in the patient's symptoms, we make the final recommendation to place the permanent shunt and to proceed with the surgery.
And a lot of people may not realize that St. Rita's has this Neuroscience Institute. They don't have to go to a bigger city. They don't have to go to Columbus or Cincinnati or somewhere like that to get this treatment. They can go right here to St. Rita's.
Yeah, exactly. We actually, this is a few centers actually follow this this exact protocol, because as I told you, the problem is not all this. Really, it is difficult to know. Even we know the treatment for this condition, it is this kind of procedure or shunt procedures, but really it is difficult to know which patient it is gonna respond to this treatment and which one does not. So basically, and this is at the end, it is not like benign procedure, because sometimes there is complication like over drainage from the shunt, or like sometimes they happen like intracranial bleed. So because the shunt need like specific adjustment and setting, because the condition under low pressure, not under high pressure. So this is basically, it is very important to make this type of screening, and to make like at least some prediction, or make like justification for the procedures for the patient. As I told you, the important in this procedure is really, it is like improve the quality of life of the patient, especially when they have this dementia, these type of like balance problems, and do the procedures that everything's get improved. I have a couple of cases, and they are so happy with the result. Yes.
Thank you so much. We appreciate your time today.
Thank you.
We'll be right back on First Edition right after this.